Hello, my name is Amanda and I am here with my classmates Brad and Marissa. We are WSU Nursing students and today we are here to provide you information about COVID-19 and the vaccines. So a little bit background on COVID-19 is it is a new infection that hasn't previously been seen in humans. The disease was first identified in Wuhan, China. The disease spreads mainly through close contact. It generally spreads from respiratory droplet particles or infected surfaces. People who are physically close to each other, about 6 feet, or people in enclosed indoor spaces are at a greater risk of spreading it. Symptoms can appear 2 to 4 days after exposure. The disease effects can greatly vary. Most people get mild cases of the virus, but a severe case can happen with anyone. There are several populations that have a higher risk of severe illness or even death from this disease. Those populations include older adults, people who are pregnant, people with underlying medical conditions such as cancer, chronic kidney disease, COPD, Down syndrome, sickle cell disease, diabetes, asthma, and high blood pressure. The total COVID cases at the time of us writing this presentation was roughly 115 million. And the total deaths were counted at roughly 2.5 million worldwide. So symptoms vary and may appear 2 to 4 days after exposure to the virus. Common symptoms associated with COVID-19 include fever or chills, cough, shortness of breath, fatigue, muscle aches, loss of taste or smell, sore throat, congestion or runny nose, diarrhea, nausea, and vomiting, and respiratory failure. Symptoms can range in severity based on comorbidities. So why should you get vaccinated? It is a way to get involved and take action in stopping the spread. The COVID-19 infection poses a potential and serious risk to you and your loved ones. Both COVID-19 disease and vaccines are new to us. It is important that we examine the potential short-term and long-term effects associated with COVID-19 so that then we can make an education plan for getting the vaccine and staying safe. Also, it is important to remember that COVID-19 vaccine will not eliminate all infections, so it is still important to take other precautions such as wearing a mask, hand washing, and social distancing. So there are 3 different vaccines currently available. The first one that I'm going to talk about is the Pfizer vaccine. This is 2-dose series separated by 21 days. It is an intramuscular injection into the deltoid. The CDC recommends being 16 years or older and is an mRNA COVID-19 vaccine. The second vaccine I'm going to talk about is the Moderna vaccine. This is a 2-dose series separated by 28 days. It is also an intramuscular injection into the deltoid. The CDC recommends being 18 years or older, and it is an mRNA COVID-19 vaccine. And then the last vaccine we're going to talk about today is the Johnson & Johnson vaccine. This is a single-dose intramuscular injection into the deltoid. The CDC recommends being 18 years or older, and it is a viral vector COVID-19 vaccine.
So just a little background on why you need to get both doses of the mRNA vaccines. So in basic terms, the first dose, this is just going to introduce the vaccine into the system and the virus. It's going to start to build up that protection, prime your immune system, and just help it recognize the virus if you were to get it. The second dose is just going to strengthen the immune response and ensure that if you came in contact with the virus, that your body would be able to protect you from it. So understanding an mRNA COVID-19 vaccine. So how does an mRNA vaccine work? So it teaches our cells how to make a protein that triggers an immune response. So to develop immunity, vaccines imitate an infection. Many vaccines work by triggering an immune response by putting a weakened or inactivated germ into our bodies. Instead, the COVID vaccine kind of just teaches our cells how to make that protein, which in turn triggers the immune response. Like other vaccines, the COVID vaccine was rigorously tested for safety before being authorized to use. It's important to remember that no shortcuts were made when developing this vaccine. This vaccine was made very quickly because it was an emergency response, and because of that, it was given emergency priority in the development. So a little bit thing about mRNA, some common misconceptions. mRNA vaccines do not carry the risk of causing the disease in a vaccinated person. They don't contain a live virus, and they do not affect or interact with the person's DNA. And they also do not cause fertility issues or concerns. This is a very common widespread myth that people have. But mRNA has nothing to do with fertility or altering your DNA at all. So understanding viral vector COVID vaccines. So how does the viral vector vaccine work? So it uses the modified virus, which is called the vector, to deliver instructions to our cells. So this is going to trigger the immune response, and our cells are going to start fighting off what they think to be an infection. They'll kind of go there and fight there. And in the end, our body is able to learn how to protect against future infection with the virus that causes COVID-19. So misconceptions with viral vector vaccines, they do not give someone COVID-19 or other infections, and they do not affect or interact with our DNA at all. Very separate. So risks of a vaccine reaction. So adverse reactions are usually mild and resolve within a few days or so. It's common to see them after 2 days, up to 10 days. Side effects can vary. A lot of people have reported more side effects in the mRNA vaccines in dose 2 compared to dose 1. But this is a good thing. This means that your body is responding correctly and your immune system's working. Just the most commonly reported reactions, just pain in the injection sites in the upper arm. So a lot of people reported feeling a little bit more tired, some headaches, and some mild muscle pain. Just important to remember that these side effects resolve between those 5 to 10 days. And we are much less severe than the symptoms that are associated with COVID-19. And how do we know these vaccines are safe? So to make sure the COVID vaccine met safety standards, they were tested in large clinical trials. So the FDC and the CDC are continuously monitoring safety. And after you'll get the vaccine, they can send you confirmation of a daily quiz you can take, just kind of listing the symptoms you're going through, how you're feeling, so they make sure that this is continuously safe. So it does take time before we learn about some very rare or long-term side effects, but they're just continuously monitoring their safety and the populations that have gotten them. So if there's any safety problems detected, there will be immediate action to determine if those issues are related to the COVID-19 vaccine, and then to determine the best course of action from there.
Okay, so then you're gonna want to be observant for when it's your time to get vaccinated, and once your tier opens up, you're gonna want to call and make an appointment. So this is an example of Minnesota's vaccine eligibility. Everyone 16 and up, as of March 30th, is eligible for the vaccine, and you're gonna want to check the state of where you reside for when you can make an appointment. And then what should I do before I get vaccinated? Wearing clothing that allows easy access to your upper arm, such as a short sleeve shirt, or wearing a short sleeve shirt under a sweater or jacket. You're gonna wanna stay hydrated. This is important for your overall health, and this will contribute to your well-being. And then with that, you're gonna wanna avoid drinking too much alcohol the night before, as that can prevent you from getting dehydrated. Eating before your vaccine can help. This can help people who have a fear of needles or who have a history of fainting. And then it isn't recommended that you take a pain medication before getting a COVID vaccine. It's not clear how these medications might impact the effectiveness of the vaccine. Some preventative medications, such as a migraine medication, are okay to take before. Then you're going to want to think of where you want to get your COVID vaccine. Many choose their non-dominant arm. After getting the vaccine, you're going to have to wait at least 15 minutes after getting the shot to monitor for reactions. So you're going to want to plan your day around that extra 15 minutes. And then if you're receiving the 2-step vaccine, you're going to want to make sure you have a plan for your second vaccine at the same location in the same state. Okay, and then for some frequently asked questions, who shouldn't be vaccinated? The CDC recommends that people who have had a severe or immediate allergic reaction to the first dose, or people who have a history of allergic reactions, should not receive the mRNA vaccine at this time. They may qualify for the Johnson & Johnson vaccine, and you're going to want to contact your primary healthcare provider with more specific or detailed questions. Can I get other vaccines at the same time? There should be a minimum of 14 days between the COVID-19 vaccines and other vaccines. That's just because in the trials, they never gave vaccines that close to each other, so the safety hasn't been tested. If I have had COVID, should I get the vaccine? So yes, you're going to want to. Antibodies have and are still being studied, and studies have found that the antibodies typically drop off or decrease after 90 days from infection. It's important that you talk with your healthcare provider if you've had COVID in the past before getting vaccinated to understand that you're still eligible for the vaccine. But if you've recently tested positive or are quarantining from a recent exposure, it's important to wait until that quarantine period is over before you go and get vaccinated. And am I fine after one dose? It's going to be no. With Pfizer and Moderna, you're going to need both because the efficacy of a single dose hasn't been evaluated. Then can you still spread the virus after getting vaccinated? And there's simply not enough information at this time to know if the vaccine stops you from transmitting the virus. But we do know that the vaccine reduces the probability that you're going to get the virus and become symptomatic. And the research also suggests that those with symptoms are highly likely to spread the virus compared to those who don't have any symptoms. And then does the vaccine prevent infections with the other COVID-19 variants? And early research suggests that the currently approved vaccines can provide protection against the COVID-19 variants that they identified in the UK and South Africa. Now, if you still want to learn more, you can contact your healthcare provider or the Minnesota Health Department. And the CDC is also a great website to use during this time. And then lastly, there are our references.